ACL reconstruction using the GraftMax curved reaming system provides a surgical technique that delivers precise anatomic tunnels without the need for hyperflexing. The GraftMax curved reaming system can be used with soft tissue or bone patellar tendon bone grafts with various fixation methods to create the preferred surgical technique. To begin, debride unwanted remnant ACL tissue and mark the center of the desired tunnel locations. Then, insert the GraftMax curved guide into the anteromedial portal with the knee flexed at 90 degrees. Then, insert the GraftMax indicator pin into the sleeve and down to bone to assess the projected guide pin exit and femoral aperture to cortex or AC length. Next, place the exact pin through the curved guide. Then, advance the pin through the femoral cortex. Remove the indicator and curved guide, then pull back on the flex exact pin, hooking the head on the cortex to confirm the AC length. Advance the flex exact pin out through the skin laterally. Next, insert the GraftMax Flex Sentinel Reamer over the flex exact pin, keeping the cutting flute away from the femoral condyle. Advance the Flex Sentinel to ream the femoral socket. Then, remove it from the joint, making sure to keep the blade oriented away from the condylar surface. Leave the Flex Exact pin in place to position a passing suture. Next, position the tip of the bullseye tibial footprint guide in the center of the tibial ACL footprint. Advance the tibial guide pin until it meets the point of the guide arm. Then remove the guide from the joint. Ream the tibial tunnel, then retrieve the passing suture through the tibial tunnel. Load the bone patellar tendon bone or BTB graft into the passing suture and pull up through the knee until it's positioned in the femoral tunnel. Insert the guide wire and tap the femoral tunnel and BTB graft. Then insert the genesys matrix interference screw over the guide wire and into the knee. Advance it into the femoral tunnel until flush. Cycle the knee with tension on the graft. Then, set the knee at the desired flexion angle. Insert the guide wire and tap the tibial tunnel and BTB graft. Then, advance the genesys matrix interference screw over the guide wire into the tibial tunnel until flush. Unthread the passing suture laterally and follow the normal procedures to close the incisions.